It's time to watch out, when neck pain can lead to disaster. You can get rid of discomfort in the neck by following simple rules, detailed recommendations. In the modern world, neck pain is an extremely common phenomenon. According to statistics, at least 10% of the adult population of the planet suffer from problems in the cervical region. The main cause of pain, as with back pain, is a long-term shift in the center of gravity. As a result, the nerves become inflamed and muscle spasm occurs, which puts even more pressure on the nerves. Hence, according to the cardiologist and nutritionist, pain occurs. Why does neck pain occur? The neck and head are designed to look forward in search of danger or food, without tilting the head forward or down. In the 21st century, this problem is common, since most people work while sitting. In this position, they, looking at the monitor, tilt their heads forward. Or lower their head down, looking at the smartphone. Cervical disc degeneration. Diseases caused by degeneration of cervical discs. As we age, the cervical discs begin to flatten and wear out. The flattening of the disc causes the vertebrae to converge closer together, which can put more stress on not only the disc itself but also on the surrounding joints, muscles, and nerves. This process is called cervical disc degeneration, and it can lead to several painful conditions. What to do? First, you need to try to keep your head in the position conceived by nature, that is, do not tilt. The more often and longer it is in a natural position, the better. To relieve an exacerbation, you can, as in the case of the lower back, drink a course of nonsteroidal anti-inflammatory drugs, for example, ibuprofen, 5 to 7 days. It is important to stretch and strengthen the neck muscles with exercises every day for 5 minutes. But it is important to understand that they will not get better right away. The effect will come after 1 to 2 weeks of regular practice. When should you be concerned? Exercise makes it worse. Nonsteroidal anti-inflammatory drugs do not help. There are neurological symptoms, example, severe numbness of hands and fingers, dizziness, etc. Loss of consciousness. Severe headaches. Pain persists at rest, lying down, at night. Pain appeared after a neck injury. Pain plus fever. Remember, if you started to sit up straight, hid the phone as far as possible, began to do exercises, but it didn't get better, do not delay your visit to the doctor. Disc herniation. A herniated disc, otherwise known as a herniated nucleus pulposus, HNP, develops when the outer layer of the disc, the annulus fibrosus, ruptures or cracks under load from the surrounding vertebrae. As a result of these tears, the soft nucleus of the disc, nucleus pulposus, can bulge or even completely come out of the disc and press on adjacent nerves or the spinal cord. Nerve compression can cause symptoms such as pain and weakness in certain parts of the body, depending on which nerve is affected. Bone spurs, osteophytes. Bone spurs, also called osteophytes, are small growths of bone tissue that form on the vertebrae as a result of increased stress on these bones. Usually, the effects of these spurs are nothing more than occasional limited mobility or neck pain. However, as with GPJ, a bone spur can press on nearby nerves or on the spinal cord, resulting in feelings of pain or weakness in a specific part of the body. Treatment of cervical disc degeneration. Modern types of treatment. For many patients, non-surgical or conservative treatments will be effective in reversing the symptoms of cervical disc degeneration. Such treatment may include a combination of rest, physical therapy, pain medication, or anti-inflammatories. If pain and limited mobility persist despite treatment, surgery is considered. Surgical treatment consists in removing a herniated disc, osteophytes, and bone spurs that provoke symptoms of the disease. This process is called decompression. Both conservative and surgical treatments are designed to relieve pain. Your doctor will determine the best treatment for you based on the severity of your degenerative disorder. Cervical subluxation can be identified on the basis of anamnesis, clinical manifestations. But the main thing in diagnostics is visualization using radiation diagnostic methods, which allow assessing the state of bone structures and ligamentous apparatus. The main method for detecting subluxation is radiography, which at the first stage is performed in two main projections. However, lateral and direct scanning is not always able to detect a displaced vertebra, therefore, scanning is performed in additional projections, including with functional load, in the state of flexion/extension of the cervical spine. To determine the further program of patient management, detailed studies are also carried out, computer or nuclear magnetic tomography. CT is more aimed at assessing anatomical formations with increased density, and MRI is aimed at detailing soft tissue structures. A neurologist consults to assess the state of the patient's nervous system. Echoencephalography allows you to determine the state of the brain, and rheoencephalography helps to determine the nature of the blood supply to the cerebral tissue.